Tell me your thoughts on training as far as, for the patients who are considering major, whether it's a plastic surgery procedure, an elective reconstructive procedure, or a full mouth reconstruction or dental implants. Most of these cases, I would say, if I were having the procedure, I would certainly want to be put under for that. What's the variation in training, for doctors who are providing the anesthesia?
Variation in training, well, in our practice here, we're doing mostly general anesthetics. In the community, it's been largely sold to do a lot of these cases under IV sedation. I don't always find that to be the best approach, especially for longer cases.
And why is that?
Because there's always an inherent risk of aspiration during those sorts of cases, and that risk.
And what are they aspirating?
What they're aspirating is, aspiration is fluid content from the stomach entering the lung during the procedure, or fluids from the surgery or
from the procedure
itself. So you want to prevent against that. In a general anesthetic, the tube is placed to prevent that from happening. So you only have one short period of time where aspiration is an issue.
Is a possibility.
Is a possibility. Yeah. Or during the emergence.
Yeah.
During a sedation case, that happens, that risk is there throughout the whole procedure. So it's sold to be less invasive.
You mean during an IV sedation case?
Right.
You're constantly worried about
fluid worried about the aspiration risk.
Yeah.
Right.
And why is it that under general anesthesia or intubation that you don't have aspiration? What creates a scenario where you're not worried about aspiration?
Well, you can have a silent aspiration under general anesthetic, but what we're doing is we're placing a cuffed endotracheal tube beyond the vocal cords, and that kind of prevents any fluids or materials getting into the lung.
So it's the cuff that creates the seal.
It's the cuff that creates the seal that prevents the aspiration.
Okay. And so can you intubate somebody who's under IV sedation?
You can do that, but you're kind of behind the 8 ball. Then you're
always chasing.
Yeah, you don't have the ideal environment from the beginning. For the tube placement, the room is small.
So in reality, there's no reason to do IV sedation versus general anesthesia if you're intubating the patient. There's no point in that. Right. And so with IV sedation, you don't have the seal to seal off the vocal cords, which will, the cuff or the seal prevents aspiration. So it seems like general anesthesia is the safest way to go.
I find that general anesthesia for the greater part of the cases that we do is the best way to go. I've observed and looked and worked in different areas, and I've seen things that are less than desirable situations, but I believe that with the medications that we have today and given properly, that general anesthesia is definitely the safest way to go.
Right.